Laughter died instantly in Dr. Thomas Aris's throat inside Trauma Bay 1. Outside, a dark, massive, and distinctly military Sikorsky MH-60 Seahawk was rattling the reinforced glass of St. Jude Medical Center's emergency department with the deafening thwack, thwack, thwack of its rotor blades. Ignoring every hospital protocol, 4 men in full tactical gear breached the ER doors as charge nurse Brenda Harrison dropped her clipboard in shock. They weren't looking for a doctor or the trauma surgeon. Instead, the lead officer locked eyes with the terrifyingly calm new nurse the staff had been relentlessly mocking all week, paralyzing the room with 5 words. "Chief, we need you now." St. Jude Medical Center in San Diego was a meat grinder, as a Level 1 trauma center positioned just miles from heavily trafficked interstates and sprawling suburban chaos. Its emergency department was a crucible that routinely chewed up and spit out fresh nursing graduates. To survive the St. Jude ER, you had to be loud, aggressive, and possess an ego thick enough to deflect the constant verbal barrage from the veteran staff. At the top of this food chain sat Brenda Harrison. A charge nurse with 22 years under her belt, Brenda ruled her domain with an iron fist and a tongue like a scalpel. She wore her burnout like a badge of honor and had little patience for anyone who couldn't match her frantic, high-decibel energy. Then came Cleo Jenkins. Cleo was 32, though her quiet, unassuming demeanor made her look younger. She was average height, kept her dark blonde hair pulled back in a tight, mercilessly practical bun, and wore scrubs that always seemed a half size too large. She had transferred in from out of state. Her file vaguely mentioned time spent overseas and a stint in a small clinic in Virginia, but she offered no stories, no bragging rights, and no desperate attempts to fit in. On her first day, Cleo was assigned to the fast-track area, the ER equivalent of the kiddie pool, reserved for sprained ankles, minor lacerations, and strep throat. Let's see if the new girl can handle a paper cut without crying. Brenda had loudly announced to Dr. Thomas Aris, the attending trauma physician whose surgical skills were matched only by his towering arrogance. Dr. Aris had simply smirked, barely glancing up from his tablet. For the first 2 weeks, Cleo was a ghost. She moved through the chaotic corridors with a silent, almost unnerving economy of motion. She didn't run when the trauma alarms blared. She walked briskly. She didn't yell for medications. She simply appeared with them precisely when needed. To the seasoned staff of St. Jude, this quietness was interpreted as weakness. In an ER, silence usually meant you were freezing under the pressure. "She's a deer in the headlights," muttered Tyler, a junior nurse who desperately sought Brenda's approval. He was leaning against the nurse's station, watching Cleo meticulously clean a sutured laceration on an elderly man's arm. "Look at her. She double-checks every dosage tag. She takes 5 minutes just to prep an IV tray. She's terrified of making a mistake." "She won't last a month," Brenda replied, sipping her lukewarm coffee. "She has no hustle, no instincts. Yesterday, I told her to jump on chest compressions for that cardiac arrest in Bay 3, and she just stood there for a second, looking at the monitor before stepping in. Hesitation kills, Tyler. She's a liability." What Brenda hadn't noticed, what none of them had noticed, was that Cleo hadn't hesitated. In that split second of standing there, Cleo's eyes had swept the monitor, noted the specific rhythm of the ventricular fibrillation, calculated the precise joules needed for the defibrillator, and recognized that the patient's airway was compromised by a poorly placed intubation tube. She had stepped in, silently adjusted the tube by 2 centimeters, and then delivered flawlessly timed compressions. But in St. Jude, if you didn't scream about your heroic save, it didn't happen. The mockery became a daily routine. When Cleo asked where the hospital stored its intraosseous drill kits, a heavy-duty tool used to drill directly into bone marrow when veins collapse, Dr. Aris had laughed aloud. "Planning on doing some construction work, Jenkins?" Aris had sneered over a patient's chart. "Leave the power tools to the adults. If you can't find a vein, page me. Don't try to play combat medic on my floor." Cleo had merely nodded, her face an unreadable mask of polite compliance. "Understood, Doctor." "It's actually pathetic," Tyler whispered to the triage receptionist later that afternoon. Aris completely embarrassed her, and she just took it. No backbone whatsoever. They laughed. They gossiped. They relegated Cleo to fetching blankets, emptying bedpans, and managing the waiting room overflow. They treated her like a fragile, incompetent student, completely blind to the way Cleo's eyes constantly scanned the room, categorizing threats, assessing exit routes, and silently triaging every single person who walked through the sliding glass doors. The true test of an ER nurse isn't the day-to-day grind. It's the mass casualty incidents. The moments when the system fractures under the weight of sudden, overwhelming trauma. It happened on a Friday evening at 6:15 p.m. A semi-truck carrying industrial solvent blew a tire on the southbound lanes of Interstate 5, jackknifing across 4 lanes of rush-hour traffic. A chain reaction involving 12 vehicles ensued. Within 20 minutes, the tranquil chaos of the ER was shattered by the shrill, continuous blare of the red trauma phone. "Listen up!" Brenda yelled, clapping her hands violently as dispatch relayed the horrific details. "We are getting 6 immediate traumas, 2 crush injuries, 3 severe burns, 1 traumatic amputation. Aris, you're on the amputation. Tyler, get the burn kits to bays 2 and 3. Jenkins," Cleo looked up from restocking a crash cart. "Jenkins, stay out of the way. I want you strictly on the perimeter. Manage the blood bank runs and keep the bays stocked. Do not touch a patient unless I explicitly order you to. I cannot afford you freezing up tonight. Am I clear?" "Clear," Cleo said evenly. Her voice didn't shake. Her pulse, had anyone bothered to check it, was resting at a cool 60 beats per minute. 10 minutes later, the double doors blew open. Paramedics flooded the corridor, shouting over each other. The smell of copper, burnt rubber, and singed hair permeated the sterile air. The ER descended into a localized hell. In Trauma Bay 1, Dr. Aris was fighting a losing battle. His patient, a 30-something male pulled from a crushed sedan, was rapidly deteriorating. The monitor shrieked a high-pitched warning. Blood pressure was tanking. Oxygen saturation was dropping like a stone. "I can't get an airway," Aris shouted, his face slick with sweat. He was frantically maneuvering a laryngoscope, trying to secure a breathing tube down the man's blood-filled throat. His larynx is crushed. "Suction? Tyler, get in here and suction." Tyler, pale and visibly trembling, fumbled with the suction catheter, dropping the sterile tip against the edge of the bed before plunging it blindly into the patient's mouth. "He's bleeding out into his chest," Brenda yelled from the other side of the bed, struggling to place a central IV line. "We need a chest tube now." "Aris?" "His SATs are at 62%. He's crashing." From the perimeter, Cleo watched. She saw the massive bruising expanding across the left side of the patient's chest. She saw the tracheal deviation, the windpipe visibly shifting to the right. She recognized the catastrophic signs of a massive tension pneumothorax. The patient's lung had popped, and air was filling the chest cavity, crushing the heart. A chest tube would take too long to set up. He had seconds. Cleo stepped forward, moving with a sudden, fluid speed that startled a passing orderly. She bypassed Brenda, reached over the surgical tray, and grabbed a 1/4 gauge needle, a thick, hollow needle usually reserved for heavy IV fluids. "Jenkins, what the hell are you doing?" Brenda shrieked. "Get back to the blood bank." Cleo ignored her. She stepped directly beside Dr. Aris, who was still violently struggling with the intubation. "Doctor, he has a tension pneumothorax," Cleo said. Her voice wasn't loud, but it cut through the screaming alarms with a commanding, authoritative baritone they had never heard from her. "You need to decompress the chest. Now." "Shut up and step back," Aris roared, not looking up. "I'm the doctor here. I need an airway, not an unsolicited consult from a glorified candy striper. He will code in 10 seconds if you don't decompress," Cleo stated, holding the heavy needle out to him. "I said get out." Aris shoved his elbow backward, knocking the needle out of Cleo's hand. It clattered uselessly across the linoleum floor. Cleo didn't flinch. She simply looked at the monitor. As predicted, the patient's heart rate spiked to 160, then suddenly flatlined. The agonizing, solid tone of cardiac arrest echoed through the bay. "Code blue," Brenda screamed. "Start compressions." Panic seized the room. Aris abandoned the airway, cursing violently. Tyler froze completely. Brenda leapt onto a stool to begin frantic chest compressions. Cleo took one step back, her face devoid of emotion. She had offered the lifeline. It had been violently rejected. In her previous life, she would have physically moved the doctor and done it herself. But here, in civilian land, protocols dictated she stand down. She watched as Dr. Aris frantically demanded an emergency thoracotomy tray, watched as they cracked the man's chest open 10 minutes too late, and watched the man officially expire. 40 minutes later, the adrenaline of the MCI began to fade, leaving a toxic residue of exhaustion and blame. Dr. Aris stood at the nurse's station, his scrubs stained with blood, furiously typing his chart notes. Brenda was beside him, glaring daggers at Cleo, who was quietly wiping down the counters in the now empty fast-track area. "Unbelievable," Aris muttered loudly, ensuring his voice carried across the room. In the middle of a code, she tries to hand me a needle. No situational awareness. Completely panicked. "I told her to stay on the perimeter," Brenda agreed, shaking her head. "She's a liability, Tom. I'm writing her up for insubordination and interfering with a critical trauma. She could have killed him," Tyler chimed in from the corner. "Did you see her face? Blank, completely zoned out. She doesn't have the stomach for this." Cleo heard every word. She tossed the sanitizing wipe into the biohazard bin, washed her hands with surgical precision, and dried them. She felt the heavy gaze of the ER staff boring into her back, heavy with contempt. She didn't offer an excuse. She didn't explain that her blank face was the psychological armor forged in the mountains of Afghanistan, or that the needle she offered would have saved the man's life. She just took a deep breath, checked her watch, and waited for her shift to end. It was 11:45 p.m. The night shift was settling into the uneasy quiet that usually followed a mass trauma. The blood had been mopped from the floors, the crash carts restocked, and the surviving patients stabilized and moved to the ICU. Dr. Aris was leaning back in his chair, drinking a diet soda, recounting his heroic but ultimately doomed efforts in Trauma Bay, one to a group of captive medical students. Brenda was meticulously filling out Cleo's incident report, pressing her pen into the paper with venomous satisfaction. Cleo was quietly charting at a computer terminal in the far, dimly lit corner of the ER. Then, the floor began to vibrate. It started as a subtle hum, a low-frequency tremor that rattled the pens on Brenda's desk and caused the liquid in Aris's soda can to ripple. "What is that?" Tyler asked, looking up at the ceiling. "Is there an earthquake?" The hum rapidly escalated into a deafening, percussive roar. The massive glass doors at the ambulance bay rattled violently in their frames. "Helicopter," Dr. Aris said, frowning. He checked the digital dispatch board above the station. It was completely blank. "We don't have any incoming flights scheduled. Dispatch hasn't radioed." "Brenda, did Life Flight call in?" "Nothing," Brenda said, her brow furrowing in confusion. She reached for the red trauma phone, but it remained silent. The noise outside was overwhelming now, far louder and deeper than the familiar high-pitched whine of the civilian medevac choppers. This was the heavy, thudding rhythm of military rotors. Suddenly, Stan, the elderly hospital security guard, burst through the sliding doors from the ambulance bay. His hat was blown askew, and his eyes were wide with panic. "We got an unauthorized landing," Stan yelled over the noise. "A massive black chopper just set down on pad 2. It's not one of ours. It looks like the Navy." Before Dr. Aris could formulate a response, the main ER doors slid open. The downdraft from the rotors outside blew a whirlwind of dust and loose paper into the pristine triage area. 4 figures strode through the sliding doors. They weren't paramedics. They were clad in dark, heavy tactical gear plate carriers, drop-leg holsters, and helmets with night vision mounts flipped up. The air of lethal, practiced competence they carried instantly suffocated the remaining bravado in the emergency room. The medical students backed away against the wall. Tyler let out a pathetic squeak. Leading the pack was a towering man with salt and pepper hair cut to the scalp, a square jaw, and eyes as cold as Arctic ice. His uniform bore the silver oak leaf of a commander. The insignia on his shoulder, a trident, was unmistakable even to civilians. SEALs. Commander David Reaper Collins did not stop at the triage desk. He didn't look at the security guard. He marched directly into the center of the ER, his boots thudding heavily against the linoleum. "Who is the attending physician?" Commander Collins barked, his voice easily cutting through the residual noise of the chopper blades outside. Dr. Aris, attempting to recover his shattered ego, stepped forward, puffing out his chest. "I am Dr. Thomas Aris, Chief of Trauma tonight. You are in a civilian hospital, Commander, and you are violating a dozen FAA and hospital regulations by landing that bird here without." Collins didn't even blink. He cut Aris off with a wave of his hand, as dismissive as one might swat a fly. "I don't care about your regulations, Doctor. I have a critically wounded operator in the back of that Seahawk. GSW to the abdomen, shattered pelvis, massive internal hemorrhaging. He is hanging on by a thread." Brenda stepped up beside Aris, falling into her habitual aggressive stance. "Well, bring him in. What are you standing around for? We have a fully equipped trauma bay right here, Doctor. Aris is the best surgeon on staff." Collins looked at Brenda, his expression entirely deadpan. "I'm sure he is, but my medic is fighting to keep my man's blood inside his body right now. And I am not handing him over to civilian staff who don't know blast trauma protocol. Not yet." "Excuse me?" Aris sputtered, his face flushing violently red. "I am a board-certified trauma surgeon. You cannot just walk in here and—" "I'm not here for you, Doctor," Collins interrupted, his voice dropping an octave, carrying a dangerous, chilling edge. He swept his gaze across the stunned faces of the ER staff. "I am looking for Cleo Jenkins." The name hung in the air, absurd, and entirely out of place. Brenda blinked. Tyler's mouth opened and closed like a dying fish. Aris looked genuinely bewildered. "Cleo?" Brenda managed to say, pointing a trembling finger toward the dark corner of the ER. You mean the new girl? The junior nurse?" Commander Collins turned his head, following Brenda's finger. Through the crowd of terrified staff, Cleo had already stood up. She wasn't trembling. Her face wasn't blank anymore. It was hardened, sharp, and intensely focused. Collins took off his tactical helmet, tucked it under his arm, and stood at strict attention. The three heavily armed operators behind him immediately mirrored his stance. "I mean," Commander Collins said, his voice echoing loudly in the dead silence of the room, "Chief Petty Officer Jenkins, former lead medical specialist, Naval Special Warfare Development Group." The ER staff stared in frozen horror as Cleo, the timid new girl they had been relentlessly bullying, stepped out from behind the computer terminal. She didn't look at Brenda. She didn't look at Dr. Aris. She walked straight to Commander Collins, her posture transforming from a slouching civilian into ramrod-straight military precision. "Status, Commander?" Cleo asked, her voice commanding, crisp, and completely devoid of the polite submission they had grown accustomed to. "It's Miller, Chief," Collins said, his stoic facade cracking just a fraction to reveal deep desperation. "IED shrapnel. We managed a makeshift tourniquet on the descending aorta, but he's coding. The flight surgeon is 2 hours away. We were in the airspace. You're the only one I trust to hold him together until we can get him to Balboa Naval Hospital." Cleo didn't hesitate. "Grab a massive transfusion protocol cooler from the blood bank. Let's go." As Cleo walked past the central desk, she finally paused. She looked at Dr. Aris, whose mouth was hanging open, and then at Brenda, who looked as though she had just been struck by lightning. Cleo reached out, picked up the 1/4-gauge needle that still sat on the edge of the desk from the earlier trauma, and slipped it into her scrub pocket. "By the way, Brenda," Cleo said quietly, "you misspelled insubordination on your incident report. Without another word, She turned and jogged out the sliding doors, disappearing into the roaring darkness of the military helicopter. The transition from the glaring, sterile fluorescence of street, Jude's emergency department, to the vibrating, diesel-choked belly of the MH-60 Seahawk was instantaneous. For Cleo, it was like stepping out of a dull, suffocating dream and violently awakening back into the only reality that had ever truly made sense. The heavy sliding door of the chopper slammed shut behind her, sealing out the gawking faces of her former tormentors. Inside, the cabin was bathed in the harsh, blood-red glow of tactical lighting. The air was thick with the distinct metallic scent of fresh hemorrhage, mixed with JP-8 aviation fuel and the sharp tang of sweat. Commander Collins clamped a headset over Cleo's ears, instantly cutting the deafening roar of the twin turboshaft engines down to a manageable electronic hum. "Pilot says we are wheels up in 10 seconds. Collins's voice crackled over the internal comms. "Balboa Naval is a 12-minute flight at max throttle. Chief, he's fading fast." Cleo dropped to her knees on the diamond plate deck beside the NATO litter. Strapped to the canvas was Miller. He was 28, a breacher she had deployed with to Syria twice. He was a mountain of a man, but right now he looked grey, shrunken, and perilously close to the edge. His tactical gear had been ruthlessly cut away, revealing a torso painted in blood and the grim, jagged entry wound of an IED fragmentation shard just below his ribcage. Kneeling opposite her was Reynolds, a young Fleet Marine Force corpsman whose hands were completely slick with crimson. He was applying massive physical pressure to Miller's abdomen, his face pale and eyes wide with the specific terror of a medic watching a brother slip away. "Chief!" Reynolds yelled over the comms, relief flooding his voice as he saw her. Shrapnel bypassed the ceramic plate. Upward trajectory. It nicked the descending aorta or a major branch. "We packed it with hemostatic gauze, and I've got direct pressure, but the bleeding won't stop. He's in profound hypovolemic shock. Systolic pressure is 50. He's circling the drain. Talk to me about access, Reynolds," Cleo barked, her eyes scanning the dim compartment. She wasn't the quiet, submissive new girl anymore. She was Chief Jenkins, DVGRU Medical, and she owned this airspace. 2 large-bore 4s in the antecubital. "We pushed 1 unit of whole blood, but the lines are sluggish. His veins are collapsing," Cleo stated, her hands moving with blinding speed. She ripped open the massive transfusion protocol cooler Collins had dragged in from the ER. "We need to stay ahead of the lethal triad. He gets cold, his blood turns to water, and he dies." Collins, crank the cabin heat to maximum. "I want it feeling like Fallujah in July in here." "Copy that," Collins replied, gesturing to the crew chief. Cleo reached into her scrub pocket and pulled out the 1 4-gauge needle she had taken from Dr. Aris's failed trauma code. She didn't hesitate. She located the head of Miller's humerus, the bone in his upper arm, palpated the insertion site, and drove the heavy needle directly through the skin and into the bone marrow with a sickening crunch. "Intraosseous line established," Cleo called out flatly. "Reynolds, hang 2 units of low-titer O-positive whole blood on the IO and squeeze the bags. Push 1 gram of TXA and a gram of calcium chloride. We need his blood to clot, not just leak out faster." As Reynolds scrambled to comply, the Seahawk banked hard to the left, lifting off the hospital pad and tearing into the San Diego night sky. The G-force pressed them into the deck, but Cleo's focus remained entirely locked on Miller's chest. She watched his respiratory rate. It was shallow. Too fast. The right side of his chest wasn't rising equally with the left. "Reynolds, look at his neck," Cleo pointed a blood-stained finger. In the red tactical light, the jugular vein on the right side of Miller's neck was distending, bulging like a thick blue cord. His trachea was subtly shifting to the left. It was the exact same physiological cascade she had witnessed in Trauma Bay, 1 less than an hour ago. "Blast overpressure," Cleo diagnosed instantly. The shockwave ruptured his right lung. He's developing a tension pneumothorax. The trapped air is crushing his heart, making the shock from the blood loss tenfold worse. "I don't have another 1-4, Gage, Reynolds panicked, digging frantically through his jump bag. I used my last decompression needle on the ground for the other casualty. Cleo didn't wait. She reached for her trauma shears, sliced through the remaining fabric of Miller's undershirt, and grabbed a scalpel from the open sterile kit on the deck. In a pristine operating room, Dr. Aris would have demanded an ultrasound, local anesthetic, and a sterile field. Cleo had a vibrating helicopter floor, a dying teammate, and about 30 seconds before Miller's heart stopped completely. "Hold him steady," Cleo ordered Collins. She located the fifth intercostal space on Miller's right side, pressed the scalpel against his skin, and made a fast, decisive 3-inch incision through the muscle. The moment the blade breached the pleural cavity, a loud, violent hiss erupted over the noise of the rotors as trapped, highly pressurized air and blood forcefully vented from the wound. Miller instantly gasped, his chest expanding fully for the first time since the blast. "Finger thoracostomy complete," Cleo said, plunging her gloved, sterile finger directly into the hole to sweep the lung away from the chest wall and ensure the tract remained open. "Blood pressure?" Reynolds checked the monitor. "Systolic is climbing. 70, 85. Heart rate is dropping to 120. Chief, you just bought him an hour. I don't need an hour. I need 8 minutes," Cleo said, her voice dropping its frantic edge, replacing it with cold calculation. "Keep squeezing that blood, Reynolds. Collins, Radio Balboa. Tell the trauma surgical team to bypass the ER and meet us directly on the roof. I want a massive transfusion infuser primed. And tell the cardiothoracic surgeon they have an ascending aortic repair the second we hit the doors. They're going to want to know who is calling the shots," Collins said, a fierce, proud grin visible even in the red light. "Tell them," Cleo said, wiping a smear of Miller's blood from her cheek, "that Chief Jenkins is bringing one of her boys home, and they better not be late." The silence in the Street Jude emergency department was absolute. It was the kind of heavy, suffocating quiet that follows a bomb detonation. The double sliding doors of the ambulance bay had slid shut, cutting off the fading roar of the Seahawk, but the staff remained frozen in their places. Papers were still scattered across the triage floor from the rotor wash. The red trauma phone sat silently on its cradle. Brenda Harrison was gripping the edge of the nurse's station so tightly her knuckles were translucent. The incident report she had been drafting, the one accusing Cleo of incompetence and insubordination, lay on the counter, mocking her. What just happened?" Tyler whispered, breaking the silence. He looked like he was going to vomit. "Did the Navy just kidnap our junior nurse?" Dr. Thomas Aris was pacing in a tight circle near Bay 1, his face flushed, running a hand through his perfectly styled hair. "It's a stunt. It has to be some kind of miscommunication. She's a recent graduate from some community college program in Virginia. She didn't even know where the intra-osseous drills were kept. She asked you where we kept them, Tom," Brenda said, her voice hollow. The realization was beginning to dawn on her, cold and sharp. She didn't ask what they were. She asked where our specific hospital stored them. "She handed me a needle," Aris snapped defensively, pointing toward the spot where Cleo had stood earlier, during a massive trauma code. She stepped out of line. "And what did that SEAL commander say the patient in the helicopter had?" A voice boomed from the hallway. Everyone turned. Standing near the elevators was Dr. David Sterling, the chief medical officer and hospital administrator of Street Jude. He was wearing a rumpled suit, clearly having been dragged out of bed, and his face was a mask of unadulterated fury. In his hand, he held a thick, dark blue folder adorned with the Department of Defense seal. "Dr. Sterling," Aris started, stepping forward to reassert his authority. "We had an unauthorized military landing. A squad of armed personnel entered my ER and—" "Shut your mouth, Thomas," Sterling ordered. The sharpness of the command made Aris physically recoil. Sterling had never spoken to his star trauma surgeon that way. Sterling marched into the center of the ER, his eyes sweeping over the remnants of the staff. He slammed the blue folder onto the nurse's station, right on top of Brenda's incident report. 15 minutes ago, Sterling began, his voice shaking with suppressed rage. I received a phone call from the United States Secretary of the Navy. Not a liaison, not a regional commander, the Secretary of the Navy. He was calling to inform me that a Tier 1 Special Mission Unit was conducting an emergency exfiltration from my helipad. When I asked why they were bypassing military protocols to land at a civilian hospital, he told me it was because the only medical provider on the western seaboard they trusted to save their man was currently emptying bedpans in my fast-track ward. Brenda let out a small, strangled gasp. Tyler backed away, trying to shrink into the shadows. She's a junior nurse, Aris insisted, his ego refusing to capitulate to reality. She's timid. She froze during the I-5 pile-up traumas tonight. Did she freeze, Thomas? Sterling asked dangerously. He opened the blue folder. Let's review the file that the Department of Defense graciously declassified for me 5 minutes ago. Since you all failed to read between the lines of her civilian resume, Sterling pulled out a sheet of paper. Cleo Jenkins. Enlisted in the Navy at 18. Fast-tracked into the Special Operations Combat Medic Program. She spent the last 8 years attached directly to the Naval Special Warfare Development Group. You know them as SEAL Team 6. The color completely Drayob. From Aris's face. That's a combat role. Women aren't usually. Chief Jenkins, Sterling interrupted loudly, was the lead medical specialist for an assault squadron. She has 4 combat deployments to classified theaters. She holds the Bronze Star with Valor and the Navy Cross. Sterling looked up, locking eyes with Brenda. Do you know what she got the Navy Cross for, Brenda? 3 years ago, during a night raid in Mali. Her chopper was shot down. She survived the crash, pulled 3 wounded operators from the burning wreckage under heavy enemy machine gun fire, and performed an emergency field amputation on her commanding officer using a multi-tool and a tactical tourniquet. She kept all 3 men alive for 6 hours until extraction. Tyler sank into a rolling chair, putting his head in his hands. She didn't come here because she couldn't handle the pressure, Sterling continued, his voice dripping with disgust as he surveyed his staff. She was placed here on a mandatory civilian integration rotation. The military is forcing her to take a 6-month sabbatical in a low-stress environment before she transitions to an advanced surgical practitioner role at Walter Reed. We were supposed to be her vacation. Dr. Aris swallowed hard. He looked at the floor, suddenly remembering the way Cleo had looked at the monitor during the code in Bay 1. The terrifyingly calm way she had offered him the 1-4 gauge needle. Dr. Aris, Sterling said, his tone turning clinical and deadly. During the code tonight, the patient from the I-5 pileup. What was the official cause of death? Aris hesitated. His throat was entirely dry. Traumatic cardiac arrest. Secondary to massive internal bleeding. I reviewed the chart on my way down, Sterling said. You couldn't get an airway. The patient's trachea was deviated. His SATs plummeted. You cracked his chest as a last resort, but you noted massive air release upon incision. Aris didn't answer. The silence was an admission of guilt. He had a tension pneumothorax, Brenda whispered, the horrifying realization clicking into place. She looked at the spot where Cleo had dropped the needle. She tried to hand you a needle for a chest decompression. You knocked it out of her hand. You told her to get out. I was the attending, Aris shouted, panic finally breaking through his arrogance. I had to secure the airway. You cannot decompress a chest if the patient isn't breathing. Standard civilian protocol dictated a man died on your table because you were too arrogant to listen to a woman who has forgotten more about battlefield trauma than you will ever learn in your entire career. Sterling roared, slamming his hand on the desk. The echo of the slap rang through the ER. Sterling took a deep breath, smoothing his tie. He reached out and picked up Brenda's incident report. He read the charge of insubordination and incompetence, let out a bitter laugh, and slowly tore the paper in half, then in quarters, dropping the pieces into the trash can. Brenda, Sterling said coldly, you are stripped of charge nurse duties, effective immediately. You will report to HR tomorrow morning to discuss whether you have a future at St. Jude. Brenda closed her eyes, a single tear cutting through the makeup on her cheek. She didn't argue. She knew it was over. And you, Thomas? Sterling turned to the trauma surgeon. Your surgical privileges at this hospital are suspended pending a full, independent medical review of the death in Bay 1 tonight. I will be handing over the security footage of that code to the medical board. You can't do that, Aris stammered, his career flashing before his eyes. I am the chief of trauma. Not anymore, Sterling replied flatly. He closed the blue folder and tucked it under his arm. And if by some miracle you retain your medical license, I highly suggest you learn to identify when you are in the presence of someone far superior to you. Sterling turned and walked back toward the elevators, his footsteps heavy in the dead quiet of the department. Dr. Aris, Brenda, and Tyler remained in the center of the ER. The monitors beeped softly in the empty bays. The overhead fluorescent lights buzzed with a mundane, irritating hum. They had spent weeks laughing at the new nurse, mocking her silence, her caution, and her perceived weakness. Now, standing in the wreckage of their own shattered egos, the silence in the Street Jude emergency room wasn't peaceful. It was deafening. The flight from Street Jude to Balboa Naval Hospital took exactly 9 minutes and 40 seconds. To Cleo Jenkins, operating in the hyper-focused tunnel vision of combat medicine, it felt like a lifetime. As the MH-60 Seahawk flared over the sprawling, brightly lit complex of the military hospital, the roof pad was already swarming. This wasn't the disorganized, panicked scramble of the civilian emergency department. This was a synchronized, highly lethal ballet of military efficiency. 6 figures in sterile blue scrubs stood completely still against the hurricane-forced downdraft of the rotors, waiting behind a reinforced crash gurney. The moment the chopper's wheels slammed onto the concrete, the heavy sliding door was thrown open. Chief Jenkins! A voice boomed over the winding down engines. Captain Gregory Hayes, Chief of Cardiothoracic Surgery at Balboa, didn't wait for the rotors to stop. He was a veteran of 2 tours in Fallujah and 1 in Helmand Province, a man who had pulled more shrapnel out of American kids than any surgeon on the western seaboard. He jogged up the ramp, his eyes locked on the blood-soaked form of Miller. "Hand off, Chief! Give it to me," Captain Hayes demanded, grabbing the head of the NATO litter as Cleo and Reynolds detached the securing straps. 28-year-old male, blast trauma from an improvised explosive device. Cleo shouted, her voice cutting through the mechanical roar with absolute clarity. Shrapnel entry right lower quadrant, upward trajectory, compromised the descending aorta. Profound hypovolemic shock. I decompressed a right-sided tension pneumothorax at 2300 hours. He has received 3 units of whole blood via an intraosseous line in the right humerus, plus TXA and calcium. Heart rate is holding at 1 to 10. Systolic pressure is oscillating in the low 80s. Hayes nodded sharply, a look of profound professional respect flashing across his weathered face. Outstanding work, Chief. You kept his tank from running dry. We're bypassing the ER. We have operating room 4 prepped and waiting. You're scrubbing in with me, Captain. I'm not credentialed for the surgical field at this facility, Cleo stated, jogging alongside the gurney as they breached the roof's double doors and hit the sterile, brightly lit corridors of the hospital. I don't care if you're credentialed at a veterinary clinic. Cleo, Hayes snapped, his eyes fixed on the elevator doors ahead. You know DEVGRU blast patterns better than my entire staff combined. If that shrapnel shifted during the flight, I need hands inside that abdomen that know what a shredded celiac artery feels like in the dark. You are scrubbing in. That is a direct order. Copy that, Captain, Cleo replied, her heart settling into a steady, familiar, icy rhythm. 5 minutes later, they were under the blinding halogen lights of OR4. The transition was jarring. From the filthy, vibrating floor of a helicopter to a pristine surgical theatre, Cleo adapted instantly. She stood across the operating table from Captain Hayes, her hands washed, gloved, and hovering over the sterile field. Miller lay beneath them, his chest laid completely open by a massive midline incision. The damage was catastrophic. The blast wave had turned his internal anatomy into a chaotic, unrecognizable landscape of bruised tissue and pooled blood. Suction! I can't see a damn thing, Hayes ordered, his voice tight with sudden alarm. We have massive retroperitoneal hemorrhaging. The shrapnel didn't just nick the aorta, it lodged behind it and sliced the inferior vena cava. He's bleeding out faster than we can pump it in. The anesthesiologist at the head of the table looked up, his eyes wide above his mask. Captain, pressure is bottoming out. Systolic is 40. We are losing him right now. I need clamps on the aorta, above the diaphragm. Hayes reached blindly into the pool of dark red blood, filling Miller's abdominal cavity, his fingers searching desperately for the source of the massive bleed. It's too slick. I can't get a grip. The tissue is entirely macerated. The heart monitor began to sound a terrifying, erratic warning. Ventricular tachycardia. Miller's heart, starved of blood, was beating itself to death. Captain, we don't have time to clamp, Cleo said. Her voice was the only calm sound in the room. The shrapnel is acting as a wedge. If you push down to clamp, you're going to sever the vena cava completely. We need to occlude from the inside. A reboa? Hayes asked, looking up at her. The resuscitative endovascular balloon occlusion of the aorta was a highly advanced, risky procedure where a balloon catheter is snaked up the femoral artery and inflated inside the aorta to instantly block all blood flow to the lower body, preserving blood for the heart and brain. We don't have ultrasound guidance prepped. Doing it blind will take too long. I don't need ultrasound, Cleo said, stepping forward. I did 3 blind rebos in the dark in Kandahar. Give me the catheter. Hayes didn't hesitate. He knew Cleo's file. He knew she had the Navy Cross. He stepped back a fraction of an inch. Do it. Cleo moved with terrifying mechanical precision. A surgical tech slapped the reboa kit into her hand. She didn't look at the monitor. She didn't look at Captain Hayes. She closed her eyes for a fraction of a second, visualizing the vascular anatomy she had studied, mapped, and repaired 100 times under enemy fire. She located Miller's right femoral artery by touch alone, feeling for the faint, thready, dying pulse. With a swift motion, she inserted the introducer sheath. Catheter is in, Cleo announced, feeding the thin wire up into Miller's arterial system. She measured the depth by the markings on the tube, calculating the exact distance to zone 1 of the aorta, just above the diaphragm. Positioning, now. Inflating the balloon, she depressed the plunger on the syringe, filling the tiny balloon inside Miller's chest with saline. Instantly, the massive welling of blood in the surgical field slowed to a sluggish trickle and then stopped entirely. Occlusion achieved, Cleo stated, stepping back. The anesthesiologist let out a massive breath. Blood pressure is spiking. Systolic is up to 120. Heart rate is stabilizing. He's back. Captain Hayes stared at Cleo, his surgical mask hiding a smile of profound relief. Chief Jenkins, he said softly, you just saved this man's life for the 2nd time tonight. Now, let's fix this plumbing and send him home. For the next 4 hours, they worked in synchronized silence. Cleo anticipated every instrument Hayes needed before he asked for it. She held retractors, suctioned pooling blood, and provided the steady, unwavering support of a veteran combat medic. When the final suture was placed and Miller's abdomen was closed, the sun was just beginning to rise over the Pacific Ocean, casting a pale golden light through the frosted windows of the surgical ward. Miller was stable. He was alive. As Cleo stripped off her blood-soaked gown and gloves, dropping them into the biohazard bin, Commander Collins walked into the scrub room. He looked exhausted, the adrenaline of the night finally wearing off, leaving deep shadows under his eyes. How is he? Collins asked, his voice rough. He'll need months of physical therapy, and he's going to have a wicked scar to brag about, Cleo said, running cold water over her face at the scrub sink. But his neurological signs are intact. He's going to make it, Commander. Collins let out a long, shuddering sigh and leaned against the tiled wall. I owe you, Chief. The whole team owes you. You don't owe me anything, Reaper, Cleo said, drying her face with a paper towel. He's one of ours. It's my job. Collins looked at her, a wry smile touching the corners of his mouth. So, About that civilian rotation at Street Jude. I'm guessing you won't be finishing out the month? Cleo looked at her reflection in the mirror. The timid, submissive new girl, with the messy bun and oversized scrubs, was entirely gone. Looking back at her was Chief Petty Officer Jenkins, forged in the fires of the world's most dangerous combat zones. No, Commander, Cleo said softly. I think my civilian vacation is officially over. 3 weeks later, the atmosphere inside the administrative conference room of the California State Medical Board was as cold and sterile as a morgue. Dr. Thomas Arris sat at the long mahogany table, his usually immaculate posture defeated, his face pale and drawn. He wore a sharp, expensive suit, but it hung loosely on his frame, as if the stress of the past month had physically eroded him. At the head of the table sat a panel of 5 senior medical examiners. To Arris's left sat Dr. David Sterling, the chief medical officer of Street Jude, his expression carved from stone. Dr. Arris, the lead examiner, an older woman with severe spectacles, said, her voice echoing in the quiet room, "We have reviewed the security footage from Trauma Bay 1 on the night of the Interstate 5 pileup. We have also reviewed the sworn testimony of your former charge nurse, Brenda Harrison, and the official autopsy report of the patient." Arris swallowed hard, his throat dry. Members of the board, I maintain that it was a highly chaotic mass casualty event. The patient presented with a crushed larynx. Securing an airway is the primary, fundamental step in the ATLS protocol. The nurse in question, he stumbled over the word, the memory of the Navy helicopter still haunting his nightmares. The nurse stepped out of protocol and attempted to interfere with the primary physician. The nurse in question, Dr. Sterling, interrupted, his voice dropping like an anvil, was a highly decorated military medical specialist who correctly diagnosed a lethal tension pneumothorax by visual assessment alone. A diagnosis you entirely missed, Dr. Arris. I was focused on the airway, Arris pleaded. The lead examiner held up a hand, silencing him. She pressed a button on her laptop, and a large screen at the end of the room flickered to life. The silent, high-definition security footage of the ER played. It showed Arris frantically digging into the patient's throat. It showed the monitor flatlining. And then, it clearly showed Cleo Jenkins stepping forward, her face perfectly calm, holding out a 1/4 gauge decompression needle. It showed her speaking to Arris, and it showed Arris violently elbowing her hand, sending the life-saving needle clattering to the floor. Dr. Arris, the examiner said, her tone devoid of any sympathy. Protocol is a guideline. Medicine is an absolute reality. You allowed your ego to override basic diagnostic observation. When a subordinate offered you the correct intervention, you assaulted her and allowed the patient to die of a highly treatable complication. The board finds you guilty of gross negligence and severe professional misconduct. Arris closed his eyes. The words felt like physical blows. Effective immediately, the examiner continued, "Your medical license in the state of California is revoked. You are barred from practicing medicine in any capacity." This hearing is concluded, as Arris sat in the ruined ashes of his career, miles away. On the other side of San Diego, Brenda Harrison was enduring her own particular brand of hell. She stood behind the counter of a brightly lit, linoleum-floored urgent care clinic, situated in a strip mall between a laundromat and a discount liquor store. She was wearing ill-fitting maroon scrubs. There were no trauma alarms here, no high-stakes codes. "Excuse me," a nasal voice whined from the waiting area. A middle-aged man was holding up a slightly red index finger. "I think my paper cut is getting infected. It's been throbbing for at least 20 minutes. I need a doctor right now." Brenda forced a painfully tight plastic smile onto her face. "Please take a seat, sir. We will be right with you." She looked at the clock on the wall. It was only 10 a.m. She had 8 more hours of this. 8 more hours of trivial complaints, endless paperwork, and the crushing realization that she had traded a position of power in a level 1 trauma center for a job, dispensing bandages, all because she couldn't resist bullying a woman who could have taught her everything she didn't know about saving lives. At that exact moment, the double glass doors of St. Jude Medical Center's emergency department slid open. Tyler, the junior nurse who had once laughed alongside Brenda, was carrying a stack of fresh linens toward the triage desk. He stopped dead in his tracks, the towels slipping from his grip and tumbling onto the floor. Walking through the doors was Cleo Jenkins, but she wasn't wearing the baggy, faded blue scrubs of a junior nurse. She was in her full, immaculate Navy service dress khaki uniform. The creases in her trousers were razor sharp. The brass on her belt buckle gleamed under the fluorescent lights. Pinned above her left breast pocket was an intimidating rack of ribbons, crowned by the striking blue and white ribbon of the Navy Cross, and on her collar, the undeniable gold-fouled anchor of a chief petty officer. She moved with an aura of absolute command, her footsteps echoing sharply in the suddenly quiet emergency room. Every nurse, orderly, and doctor turned to stare. The memory of the black helicopter and the armed SEALs was still fresh in everyone's mind. Cleo walked directly to the main HR desk adjacent to the ER. The receptionist, a young woman who had heard the rumors, looked up with wide, terrified eyes. "I'm here to clear my locker and collect my final administrative paperwork," Cleo said, her voice polite, professional, but completely unyielding. "Yes, ma'am. Chief," the receptionist stammered, frantically digging through a file cabinet. "Dr. Sterling had everything prepared for you. We have your things in this box." She lifted a small cardboard box onto the counter. Inside were a few textbooks, a spare stethoscope, and Cleo's St. Jude ID badge. Cleo picked up the badge. She looked at the terrible photo of herself, remembering the day she had taken it, actively trying to look small, insignificant, and unthreatening. She dropped it into the nearby trash can with a dull thud. As Cleo turned to leave, Tyler stepped forward, nervously wringing his hands. His face was flushed with shame. "Cleo. Chief Jenkins," Tyler said, his voice trembling. I wanted to apologize. We didn't know. We didn't know who you were or what you had done. We treated you terribly." Cleo stopped. She looked at Tyler, her eyes cool and assessing, the same way she had looked at the crashing monitors in Trauma Bay 1. "You shouldn't have to know someone's resume to treat them with basic professional respect, Tyler," Cleo said quietly. Her words weren't angry. They were simply a statement of undeniable fact. "You thought my silence meant I was weak. You thought your volume meant you were strong. But in this job, panic is loud and competence is quiet. Remember that the next time a new nurse walks through those doors." Tyler swallowed hard and nodded, staring at the floor. "Yes, Chief." Cleo picked up her box, turned her back on the St. Jude emergency department, and walked out through the sliding glass doors into the bright, blinding Southern California sunlight. She had a debriefing at Balboa at noon and a flight to Walter Reed on Monday. Her vacation was over, and the real work was waiting. The chaotic, unforgiving halls of St. Jude Medical Center had demanded loud egos and aggressive posturing, breeding an environment where arrogance overshadowed actual skill. Dr. Thomas Aris and Brenda Harrison built their careers on the subjugation of others, mistaking a toxic hierarchy for medical excellence. They looked at Cleo Jenkins and saw only a quiet target, entirely failing to recognize the profound, lethal competence forged in the world's darkest combat zones. When the ultimate test arrived, their brittle confidence shattered, costing a man his life and stripping them of the careers they held so fiercely. Cleo, however, never needed validation from those beneath her standard. True mastery doesn't need to shout to be heard. It simply steps forward when the system fails, calmly hands you the needle, and does exactly what needs to be done. In the end, the ER learned a devastating lesson. Panic screams, but expertise whispers.